Easy to listen to question and answer format. To find out what we are discussing today and to introduce us to the visiting specialists, here is the producer and the host of Health for Life, Dr. Surendra Prasad.
Okay. That brings us to the next question, and it's from Mr. Hussein in Lajalasi. And I guess many of our parents are concerned about different temperatures as it relates to different ages. And so his question is, what is the normal temperature for a child who's 4 years old?
It's the same. The temperature doesn't vary in human beings. We are made up of cells, and the cells have an optimum temperature of operation. And so the optimum temperature is usually 37 degrees or approximately 98.4 degrees Fahrenheit.
Now, the next question is a little bit off of what we're discussing, but it is about a fever. And it's for one of these unique scenarios where parents hear about fevers and their concern is, I've read about rheumatic fever. Dr. Jabour, what about this? Am I being concerned about my child and rheumatic fever?
Rheumatic fever is actually a specific entity. It's a specific disease. And this is an example we say we build perfectly, etc. But sometimes nature, God, whatever, does do things a little different. I don't want to say he makes a mistake. God does make mistakes. So for whatever reason, things will go a little bit haywire with the immune system. And in the case of rheumatic fever, what happens is that it's a particular organism that has invaded the body. And so it's usually Streptococcus or staph. In this particular strep is the usual organism, and a particular type of strep, but we won't go into that. And so when this organism invades the body then turns on its immune system, and it starts to produce the antibodies to go and kill the strep. Unfortunately, it makes a mistake. And in the process of producing these antibodies to attack the strep, it attacks the body itself, particularly the heart and the valves of the heart, and affect blood vessels and other things as well. But the major thing about it is that it has a predilection for going towards things like the heart valves, and the mitral valve in particular is the most prone for it. And so these antibodies, in killing the Streptococcus, also damages the heart in the process. And so this condition, when it does that, is called rheumatic fever.
Okay. As I'm looking at the next question, which is from Melissa in Eccles, before I give you the question, it brings up the cultural environment, because the question she's asking, I've heard it from grandparents and the aunts and everything. And the question is there such a thing as a growing fever?
Short answer, no. No. What they usually mean is that the period of time when the child is most prone to the infections, because when he starts off, he has no ability to fight infections. His immune system hasn't recognized anything, hasn't produced any resistance of any kind. And so he's now building his immunity. And at this period of time, it's usually also when he's growing the most rapidly. And so when they'll see the child having a fever, and at the same time he's growing, and they notice, oh, well, he's grown rapidly over this period of time, but they can't find a cause for it. So human beings don't like not to have reasons for anything. So they find reasons. And one of the things is that they'll get a fever at this particular time, and it's also the time that he's growing, so they put 2 and 2 together and come up with 5. Say, okay, he's getting growing fever. Having said that, there's another thing that we should mention in relation to this where pediatrics doesn't understand why, and that is something called growing pains, which is something that is acceptable, that at a certain point in time when the child is growing rapidly, especially the long bones, and they grow very quickly in periods. They don't grow steadily. Children don't grow steadily. They grow, stop, grow, stop. They're called growth spurts. Okay? So when they're in that growth spurt, the bones are really stretching very rapidly. And for some reason, they'll cause pain in the growth plates and then especially the long bones. And those are called growing pains, and they're well recognized as being a problem. But in terms of growing fever, per se, it usually means that at that point in time, the child is fighting a virus.
In the program, the first half of the program, you talked about antipyretics, and I want us to describe that because not every one of our viewers will know what an antipyretic is. And then the second part of the question I have, aspirin. We have generally walked away or moved away from utilizing aspirin in children. And I want you to comment on that. So the first part has to do with antipyretics.
Okay. The word pyretic is the medical term for fever. Okay? So an antipyretics means anti-fever. Okay. So these are medications whose job is to lower the body's temperature. And they do them by various mechanisms. Some of them will act at the thermostatic mechanism. Some of them do it simply by introducing sweating. And so I'll get parents will come and say that the child is febrile and he's got a fever and he's really sweating. And they've given him ibuprofen or paracetamol, and he's really sweating. That's because the drug's job is to make him sweat. Okay. That's what it's doing. It's making him sweat. And everybody knows that as an adult, if I get a really high fever and I'm sick with a virus, one of the things I'll do is to take a couple of paracetamol or a couple of ibuprofen and a hot cup of tea, and I'll climb into bed, cover myself up from neck to toe because I'm shivering usually. And that's one of the mechanisms that the body does in terms of fighting the organism, is that you shiver and you feel cold. And people find it strange, he's got a fever, but he's shivering, But that's one of the mechanisms that they're using, the body's using to fight the infection. And so what I'll do, I'll just get on the thing, and I'll sweat like crazy. And then an hour or two later, you wake up and the fever is broken. The medications and my technology has lowered my body's temperature.
And then the second part of the question is, you mentioned that the key medications would be acetaminophen or paracetamol, yeah. Similar drug, just two different names. But what about aspirin and its use in children?
Aspirin has been given a bad name.
Yes.
Okay, it really has been given a bad name. And that's just to do with the drug companies and the fact that they're producing medication. But in fact, aspirin is the gold standard for certain types of medications. These medications are called NSAIDs, NSAIDs. And that stands for non-steroidal anti-inflammatory drugs. And they all work similar to aspirin. And a lot of them are derivatives from the technology of aspirin. And aspirin, being one of the oldest drugs, has been around for ages, and it's cheap. It's very cheap. Drug companies don't like that. So one of the things that, unfortunately for aspirin, is that it has bad effects. All the NSAIDs can have effects on your stomach. And it can interfere with your stomach's defense mechanisms against acidity, and you can end up with stomach ulcers, etc. It can do this with any of the NSAIDs. Drug companies claim some are better than others. But aspirin per se, there's nothing wrong with aspirin, its use in children. And children tend to tolerate these type of medications better than adults. Now, the problem we have with aspirin, in pediatrics especially, is that there is a condition whereby with chickenpox, if you have chickenpox, there's an association with the chickenpox virus and the use of aspirin, and you can develop a condition that's called Ray's syndrome, which is a very serious and deadly disease that, as a consequence, you get increased brain damage, to put it simply.
Correct. All right. Now, our next question comes from Natasha in Monrepo, and what she's inquiring about is that your child has a fever and the child develops a febrile fit. What should the parent be doing?
Try hard not to panic, okay? Because if it's there's some criteria that we follow, okay, that defines a febrile fit, and this is a distinguishing from the more serious type of fits, which is the afebrile seizures or epilepsy, which is a disease. Again, epilepsy means fits, but without a fever, and there are various causes of that, okay? So with a child who is between the age of 6 months and 6 years, that is not such a serious situation, okay? As I said earlier on in the program, it's related to the irritability of the brain. Now, the criteria that we follow: 1, first of all, there must be a fever first. That is distinguish it from the afebrile or no fever fit. There must be a fit first. The child must be between the ages of 6 months and 6 years of age. It must be a full-blown fit and not a partial fit. And by a partial fit, I mean it must not be one arm jerking or one face twitching, something like that. It must be a full-blown convulsion. It looks terrible because the child is going to be rigid, straight, eyes roll up, jerking. It must be a full-blown fit. The fit must last less than 15 minutes. And the fit must not need any medication to stop it.
Okay.
Okay? Once it fits that 5 criteria, usually that is a true febrile fit. There's some additional criteria that secondary characteristics. One, there often is a family history of it. And it's nice when there's a family history, because then the parent would know that, well, they had a fit when they were a child, and they're perfectly okay, and they're fine, and they're not neurologically impaired in any way. And so that's quite helpful. Other criteria is that after the fit, when the child recovers from it, the child must go back to being completely normal. In other words, there's no residual paralysis or speech impediment or hearing or anything like that, okay? And once the fit fits those criteria, that type of fit will not cause a major problem, okay? They will grow up, become quite perfectly normal neurologically. They will tend to transmit it to their parents because it's often hereditary. And the 1/3 of children approximately are allowed to have one fit like that in their lives.
Okay.